Good morning, and thank you all for joining us. My name is Ariane Dowdell, and I am the Vice President and Chief Diversity, Equity, and Inclusion Officer for Houston Methodist Hospital. Although we can't be together in person due to COVID-19 safety restrictions, we are very thankful to have the opportunity to gather together virtually this morning. COVID-19 has changed the way we live and has sadly taken the lives of more than 419,000 Americans. I think we can all agree that a vaccine for COVID-19 couldn't have arrived soon enough. With so much information at the touch of a finger, it can oftentimes create more questions and understandable concerns when it comes to the vaccine and what it means for each of us. We have organized the town hall this morning to provide you with an update on COVID-19 and, more importantly, answer your questions so that when you have an opportunity to become vaccinated, you can feel comfortable knowing you've made an informed decision that is best for you. I'm so pleased to have the President and CEO of Houston Methodist, Dr. Marc joining us, as well as the Associate Division Head of Hospital Medicine for Houston Methodist, Dr. Victor Narcisse, here with us this morning. I will now turn it over to Dr. Boom, who will begin with an update on COVID-19 as well as the vaccine. Dr. Boom?
Thank you, Ariane. I appreciate the introduction and welcome everybody. It's good to virtually see each of you today, and I thank you for joining us. As Ariane said, this is really great news right now that we have vaccines in place that are against this disease. And a lot of institutions, a lot of organizations together working to vaccinate as quickly as possible. So what I want to do today with you is quickly review the situation on the ground in terms of COVID, and then specifically talk about some of the logistics of community-wide vaccination for COVID. And then I'm going to turn to Dr. Narcisse, who's going to go through some of the medical and scientific and clinical data supporting the safe and effective use of these vaccines. So to talk about where things are right now in our community, I'll use this curve. Now, if you ever want to see this curve, all you have to do is go to the HoustonMethodist.org website, and then there's one of the boxes in the upper right says COVID statistics, and you can click on that, and there's about four different slides you can see. This is each and every day throughout the pandemic, the number of patients that have been in one of our hospitals. So to put that in perspective, we have about 2,300 beds across all of Houston Methodist. That's 8 locations across Greater Houston. And at peak, we've had well over 700 of those beds at use for patients with known COVID. Usually there's another 50 or 60 or 70 in workup. So really at peak times, even about 800 plus beds with somebody in some sort of workup or protection or treatment for COVID. What you see here in the blue line is really the total number of patients. And the key things to call out is, what seemed, so tumultuous in the spring ended up being, in the scheme of things, relatively small. That was because of very significant measures we took as a community to bring the spread down. In the summer, we were very, very busy, as you saw. It went up very quickly. It plateaued for a couple of weeks and then came down pretty quickly, so that between 20th or so of July down to about mid-September, about 2 months, we went from having 750 or so patients in-house total down to about 140, and so a pretty big spread. I attribute most of that to the mask order and to everybody really finally doing all the right things together to get that in control. What you saw then is we started growing and growing at a little slower rate than this summer. I think that's, again, masks and other things that we were doing carefully. But winter came, colder weather came, more indoors weather came, schools opened, more businesses opened. We let our guard down, quite frankly, during the holiday season, no question. And we saw peaks in earlier January that were higher, actually, than what we saw this past summer. Thankfully, we seem to have gotten over that peak. But just as the uptick was slower, I think the early data is suggesting that we're going to see a slower downhill from this. And so we're probably looking at a good solid couple of months of a decline in COVID, hopefully accelerated by vaccines, but quite frankly, there's not enough vaccine out there yet to be causing this decrease. This is because of all the things we know work in society: wearing a mask, socially distancing, physically distancing, avoiding unnecessary social situations, etc. This is our model that we use and update regularly. And in early December in blue, that was what we were predicting would happen. And you can see in orange, it was actually, I'm sorry, I said that backwards. In orange, it was what we were predicting. In blue was what was actually happening. So in early December, we were a little slower than what we projected. But in late December, really with the holidays, things grew very, very dramatically. Thankfully, we seem to have peaked a hair earlier than our model was suggesting. We're glad about that. But it seems to also be plateauing a little right now. So we're watching that very carefully and hoping to see this continue to decline. The key message is we all have to work together as a community to get this virus in control. As Arian said, this has been quite devastating around the United States, devastating in our community. We surpassed a couple weeks ago now 400,000 COVID deaths in the United States. It took 6 months to get to the first 200,000, so about 100,000 each quarter. It took about a quarter to get to the next 100,000. It only took a month to get to the next 100,000. And right now, unfortunately, we're well on track to break 500,000. If you look at the right, what you see there is over the last several years, you see the causes, the number 1, 2, and down below you see all the other causes of death. Number 1 every year is heart disease. Number 2 every year is cancer. But what you saw last spring is the number 1 cause of death, that's the magenta line, was COVID. Throughout most of the year, it was solidly the number 3 cause of death. And in late 2020, it again became the number 1 cause of death. And I'm sure when we have updated national data, we're going to see it right there about the number 1 cause of death through the early parts of 2020. So this has been 21. This has been obviously a very, very severe disease. We need to work together to bring this down. So let's talk about vaccinations. 2 months ago or so, we all learned that there was going to be, a little more than 2 months ago, that there would be 2 vaccines coming out. First Pfizer came out, then Moderna. Both a new kind of vaccine that uses mRNA technology, and both 94-95% effective, which was better than our wildest dreams, honestly, would have assumed. And we've seen a pretty significant rollout, lots of press about the rollout being a little slower than the government had assumed and promised. But nonetheless, it has been ticking up very steadily. This is the number of vaccines given each day in the United States. And what you see there in the line, that is a 7-day moving average. So you see now very solidly for about the last week to 10 days, more than 1 million doses per day being given in the United States. We know that with the new administration, one of the promises was 100 million doses in 100 days. We seem to be well on track to that. We're hearing there will be about a 10 or 15% increased supply of both Pfizer and Moderna, so we'll see this tick up again. And as we'll talk about, we're now starting to see early signs that we'll see some additional vaccine candidates, probably Johnson & Johnson, being released sometime in about a month to 6 weeks, most likely, and that'll help accelerate this as well. If you look across the United States, Texas, being, of course, one of the bigger states as well, is number 2 in the country in terms of the number of vaccinations given. It's doing very well in terms of the number per 100,000, certainly among big states doing very, very well. So the net effect right now is about 1 out of 17 Texans have received at least 1 dose of the vaccine. That's just under 6,000 per 100,000, or 6% of people. And then you can see there's about 7,200 per 100,000 doses that have been given. That's because of those people who've gotten 1 dose, a number now have gotten 2 doses. And that really, every day I look at that, continues to tick up. We've been a big part of that in the greater Houston area at Houston Methodist, as have our colleagues across the Texas Medical Center, the city, the county, working really arm in arm to try to make sure that we can move this as quickly as possible. This is what we've done since the beginning. In blue, you'll see each day how many first doses we give, and in the orange, you'll see each day any of the second doses that start kicking in. So we're up to about 83,000 people have received 1 or more doses, and another 23,000 plus that have received their second dose, for a total of about 107,000 vaccinations given. And you see it ebbs and flows a little. This is entirely based on the supply we receive from the federal government. If we received more supply, we'd be doing more. So would each of the other hospital systems. So would the city, county. And frankly, if there was much more, we'd have this all in pharmacies and everywhere else. And so the major constraint slowing things down right now is still the supply of of vaccine coming in. We literally tightly plan this every single week, so we're essentially running out by the time the next shipment comes in. I mean, literally, I'm working with our pharmacy lead, nervously looking at the system to make sure that A, that the doses get allocated to us, and B, that they show up when they're supposed to show up each week so that we can continue on that cadence. Our success resulted in Governor Abbott coming and visiting us about 10 days ago. It was a wonderful visit where he acknowledged and recognized the great teams of individuals across Houston Methodist, across the Texas Medical Center, across our community, who are all working together to vaccinate Houstonians as quickly as possible. So let me talk about what that looks like for our whole community. And this is work done by the Texas Medical Center that we've all worked together across all of the institutions, as well as with the city and the county. So the population of Houston is roughly, let's call it 7.1 million people. For Pfizer, anyone over 16 is eligible to receive a vaccine. For Moderna, anyone over 18. So you see that second bar is the 18 and under. So it overstates a little who's ineligible, but most of the people in that can't get a vaccine right now, period, because it's not been approved for use in children yet. We hope later in the year we will have approval. And so then towards the right, you see those other two bars, which are really the population that's eligible to receive vaccine. So if we need to get to herd immunity, we need to essentially vaccinate everybody over in those right two bars. And here's the challenge we have so far. If you look at the left box on the red, we've received, call it 430,000 doses into the greater Houston area for first doses. We've been getting matching second doses, but the first doses to start vaccinating individuals right at 430,000. Weigh that against an overall population of 7.1 million, or the eligible population of 5.5 million or so, and you see that's only a small fraction of people. In the bottom right, I want to call your attention to that red box. That red box talks about the number of people in the 1A category. That's everybody in healthcare, that's ambulance, that's home health workers, that's really anybody who's touching and working with patients across many, many realms, both within hospital systems and many, many outside of hospital systems. That's 420,000 individuals alone. So those were prioritized both nationally and in Texas first. So if every single one of those people got their vaccine first, we'd only just now be getting to the public. But thankfully in Texas, we had a lot of flexibility, recognizing not everybody could get there quickly enough. Not everybody wanted to get there right away in that group. And so we've been vaccinating patients in 1B for weeks. And that 1B group is a very broad group, but at Houston Methodist and most of the hospital systems, we've really been focusing on the oldest individuals who should be getting vaccine. So if you look at that small blue bar, that's over 800,000 people. That's how many people in greater Houston are 65 and up. So if you look at that group and you look at the 420,000 1A, that's about 1.25 million people, and we've gotten about a third of that supply in so far for first doses. So you can see we have a good way to go to get through the elderly population before we really begin actively focusing on younger individuals. Now there are pockets of younger individuals, transplant patients for instance, where we're very actively working to get protection into those individuals, but by and large most of the focus and the work we're trying to get synchronized with the city and county also has been to focus on the older people, because we know when we look at our data, about 3/4 of the patients who have died from COVID are 65 and up, and that gets high, it gets worse and worse as you go up the age spectrum. We've been getting about 70,000 doses a week now into the greater Houston area. So if you look at, there's about 800,000 people, maybe 750,000 people left in that 65 and up age range. That's another 10 weeks of supply. Now, not everybody's going to want it or get it right away. So it's 5 or 6 more weeks probably of focus primarily on those groups, I think, before we'll start to move into younger groups of individuals in large quantities as we continue to move forward. We've worked together very well as a community. This is the Texas Medical Center institutions, this is the city, the county, pharmacies, and others, looking at if we had enough supply, could we get the population to herd immunity, and how far can we do that? And the bottom line is we believe we can very much target a 240 days, which is what Fauci's been talking about across the United States, but really could even do a 180-day vaccination of everybody. That's including doing both doses, etc. The issue is supply. So if we wanted to get to 180 days, that's about 52,000 doses a day. That's first and second doses. So once you're in steady state, call it 26,000 first doses a day, 175,000 a week if you do that 7 days a week, and we're getting about 70,000 in. So we're not getting anywhere near the supply to do that, or frankly yet, even the 240-day plan. So we're really hoping we continue to get more from the federal government. I think the plans are in place, the infrastructure's in place to coordinate that across our community. So I'll end with two slides, the first of which is the advice I give everybody who asks about vaccines, kind of encapsulated in one slide. The first is, and you'll hear that from Dr. Narcisse, we've taken a really close look at this as our scientific teams, our medical teams. I'm a physician myself. I would vaccinate every single individual that is, anyone, and recommend it to them, short of just a couple of exclusions that Dr. Narcisse will talk about. These are safe and effective. Get them when you can get them, but please wait your turn so that we can get to the highest risk individuals, because really the goal is to bring death down and ultimately control the pandemic. But let's save lives as our very first goal. Please be patient. This is exceedingly complicated. When there is, orders of magnitude more demand than there is supply, it is frustrating. It's like trying to find a PlayStation when the PlayStations aren't there, but worse, right? And so it's extraordinarily difficult. We understand people's frustration. We'd like nothing more than open up this wide to everybody who wants it, but there just isn't enough supply for that yet. Remember, the prioritization is created nationally, but then ultimately each state determines its own prioritization. I think Texas has done a really great job at this. In fact, I'm really glad we live in Texas, because we did what now the rest of the country has been pivoting towards. But please wait your turn. Don't jump the lines. Let the most vulnerable in our community get protected first. Recognize, and Dr. Narcisse will talk about this, that these vaccines, like any vaccine, have some side effects. They're mild, but they're common. They're way, way, way better than getting COVID. And then very importantly, take the first vaccine you can be offered anywhere, anytime. Again, when it's your turn. Don't wait about which location's better, or should I get Pfizer or Moderna, or quite frankly, most likely, even when the next ones come out, and we'll talk about some of the data there, that they look very, very effective, but maybe not quite as effective as Pfizer or Moderna, but any vaccine is going to be better than no vaccine. So get vaccine that you're offered anywhere, anytime when it's your turn. And remember, it's going to take a while to extinguish this and to bring this down, or really it's probably not going to be extinguished, but bring it back to a level where this becomes more like a baseline flu that we all deal with in the future. So it's going to mean we have to continue to wear masks, socially distance, etc. In the future. And I'll end with a photo of the first day that vaccines arrived. So these are some of the individuals at Houston Methodist that received their vaccines that very first day. Up in the top left is Dr. Ashley Drews, who's our epidemiologist across all of our systems. So she's led a lot of this response, a big-time expert in infectious disease. She was the #1 person to get this here, leading by example, saying, hey, I've led up those scientific looks. We know this is safe. We know this is effective. I'm going to do that. Johnny Leonard in the upper right corner runs all of our emergency rooms. Pablo Vasquez in the bottom left corner runs one of our highly infectious disease unit out in West Houston, which has cared for patients with COVID throughout. The three gentlemen on the bottom right there are ICU physicians who take care of COVID patients each and every day, and the woman in the top middle is one of our medical assistants who works and takes care of patients each and every day. And so you see those frontline individuals running towards the vaccine saying, it's safe, it's effective, I'm going to get myself protected so that I can care for patients and be there when they need me, but also going to lead by example so that the world knows that these are safe. So thank you very much for your time today, and I'm going to turn things now to Dr. Victor Narcisse. Dr. Narcisse is the Associate Director for Hospital Medicine for our hospitalist program at Houston Methodist. So he takes care of a wide array of people in inpatient settings. In fact, I was asking him this morning, and about 1/3 plus of the patients he cares for each and every day are in our hospitals right now. Cared for with COVID, and so he's quite expert on the front lines, and he's going to talk to you about our COVID vaccines. Thank you. Dr. Narcisse.
Thank you. Well, we've been fortunate that we've had a tremendous amount of development in the front of vaccines, Right now, there are two vaccines that are widely available, first from Pfizer and then subsequently from Moderna. These have been well studied, well vetted. The picture you're seeing is the cover of their articles in the New England Journal of Medicine, one of the most prestigious medical journals in the community. And we've had a significant chance to look at the data. People have asked, was it rushed? Was it well studied? I think that the answer is that it has been. We feel very, very comfortable with the data that these work. I have personally received my 2 vaccines. The important piece to note is that if you look at the data in both of the slides, these are tremendous improvements over when the patients get the vaccines compared to when they don't. This is better than what we see with most vaccinations in the community for other types of disease processes. So these medicines work. They're very, very effective. What I wanted to show you is how this works. First, the vaccine is given and it generates an immune response. In both cases, we look at the T cell response, and at 100%, 94%, this is amazing work. Both of these vaccines use a relatively new technology where the patient is given messenger RNA, and then your own body produces the spike proteins that are recognized and then can later be targeted. So I often will tell people it's like you're making your own enemy uniforms to raise the alarm so that your body knows that it's being attacked. Does this work? Yes, it does. 94, 95% efficacy, that's essentially the same, and this is amazing. This is far better than what we see in general. And what's even more important and more impressive is how effective these vaccines are against severe disease. Severe disease is what puts people in the hospital and what causes them to die. And both are highly effective. We don't yet understand how well it will work against small asymptomatic infections, but what we do know is the type of infections that lead persons to come to the hospital and get very, very sick and die, these medicines work. They've been well studied, and we feel very, very comfortable with them at a personal and a professional level. But there are side effects. Most of these side effects are reactions to the medicines, not allergies. And the basic way to understand is it's like feeling like you've had the flu. Fevers, fatigue, headache, chills, GI symptoms, feeling really tired, hurting, particularly pain at the site of the injection. These things are all very, very common. And they are more common than folks who did not receive the vaccine and got the placebo instead. But these are signs that your immune system is ramping up for the fight and can manage the things that are coming to you. So it's okay. If you have one of these symptoms, we aren't telling people to pre-medicate, but if a symptom develops, symptomatic medicines like acetaminophen can be utilized and very effective. Right now, I don't have any patients in the hospital with side effects of the vaccine. What we would particularly be worried about are serious adverse events. Adverse events that led to persons withdrawing from the trial were essentially the same in the vaccine groups and the placebo groups for Pfizer. The significant allergic reactions, I think many of you have heard about some of the allergy type symptoms that people have had. Those are, again, very similar for the patients who receive the vaccine versus those who receive the placebo. There are new vaccines that are coming to availability very, very soon. In the last 24 hours, Johnson & Johnson and Novavax have both made announcements of their trials. Johnson & Johnson was today, it announced 47,000 participants. It was done in a variety of countries across the globe. They have not yet published their data. They've just given a press release. The interesting thing about the Johnson & Johnson vaccine is that it's a single shot. And the logistics of the first and then the second, 3 weeks or a month later, become significantly less complicated. And additionally, there are storage benefits to the Johnson & Johnson vaccines compared to the others. Well, it works differently. Instead of the mRNA and your body using instructions to tell the immune system to get ready for the fight, the Johnson & Johnson vaccine used essentially a cold virus, the adenovirus, and it put the instructions inside. And again, this is a type of a vaccine that cannot give you the COVID illness itself, and it was fairly effective. 66% effective in moderate to severe COVID-19, 72% effective in the US. And it was highly effective against the most severe disease that leads to hospitalization and death. This is exciting. And had we not heard about the 94 and 95% in the other vaccines that are now available, Johnson & Johnson's vaccine would be exciting news and cause for celebration. Additionally, Novavax has also made an announcement of a slightly smaller study that was done predominantly in the UK. They've done other studies in South Africa, but again, not yet published, just made announcements, and they're using the delivery of the protein itself. The other vaccines are trying to teach your body to recognize the spike protein. The Novavax technology actually delivers that spike protein, and the body can then identify this is a problem, we need to launch an immune response. It has also been fairly effective, 89% effective, mild, moderate, and severe disease. It was slightly less effective in the newer strains that we're seeing that have developed in the UK compared to the original, 95% effective in the original, 85% effective in the UK strain. So this is a slight cause for concern. Additionally, in South Africa, where there's a separate new strain, there was only about 49% of efficacy. That was a smaller trial, and it's possible to come to final conclusions, but it is, again, a concern for alarm. And this is one of the reasons why Dr. Boone is recommending everyone to get their vaccinations done as quickly as possible. There are individuals who do get the severe allergies. And again, this is something that's of great concern. There's been a lot of discussion in the national press about the severe allergic reactions, but they are rare. And the majority of them have happened within 15 or 30 minutes of the delivery of the vaccine. So what we're recommending is that individuals wait and are observed in the vaccination location for a little while to make sure that everything's okay. There are fairly easy to administer treatments, antihistamines, which are essentially over the counter. We can use those also by vein. And EpiPen for those individuals who already have severe allergies are available. Again, there have been 0 fatalities that have been definitively connected to severe allergic reactions of the COVID vaccines. There are individuals who have to have precautions. If you have a history of allergies, those are the individuals that have concern. And by allergies, we don't mean that you've got the allergic rhinitis, the common sniffles that everyone in Houston seems to have. But these are individuals who have documented allergies to medicines or to food. In this particular case, specifically to vaccines, if you've had anaphylaxis at all, 33% of the patients who've had difficulties had a history of anaphylaxis, and many of them already had the EpiPen and the medications on their person because they were aware of this. So if you have a history of allergies to any vaccines, or you've had an allergy to the first dose of COVID, a severe allergy, not the headaches, not the fevers, not the I feel bads, but an allergic reaction that requires treatment in a medical facility, those are individuals that we may choose not to vaccinate a second time. At the end, what's the bottom line? The risk-benefit is very, very clear. If you live in the United States, the risk of contracting COVID is significant. It's not 0, but the concerns around long-term complications are about 1 to 2%. You have about 100. If you get sick, about 100. 1 in 100 will get hospitalized. 1 in 1,000 will die. 1 in 100 will be hospitalized, 1 in 1,000 will die. These risks are significant and they're cause for alarm. These are the people that we see in the hospital all the time. The vaccine risks, while common, they're very, very mild. The anaphylaxis risk is very, very small. There could be other rare side effects. We'll have to wait and see. There's not enough information. But so far, no deaths have definitively been linked to the vaccination efforts.
Thank you, Dr. Boom and Dr. Narcisse. We really appreciate that. I want to take a few minutes. So many of you were kind enough to send in your questions that you had, which is really a big focus that we have today. And I want to let everyone know that I personally have read every single question that has been emailed. And as we went through the presentations this morning, I'm hopeful that a lot of your questions were answered. But I'd like to take a little bit of time right now to ask Dr. Boom and Dr. Narcisse some of the questions that still remain that I hope will answer any additional questions. I also know that we've been busy on the chat during the conversation this morning, and so hopefully some of the things that have come up will also be addressed in the next 20 minutes or so. So I'd like to start, Dr. Narcisse and Dr. Boom. I know you, Dr. Narcisse, mentioned that you've been vaccinated. Dr. Boom, have you been vaccinated? And to both of you, I'm curious to know, did you have any side effects?
Sure, I guess I'll start. Yes, I've been vaccinated as well. I waited for about 8,000 plus of our frontline workers to get vaccinated first, but then frankly wanted to lead by example. I am a physician also, so I see patients, and actually did one of our vaccination events a couple weeks ago and personally vaccinated a lot of people, which was incredibly rewarding to see the joy on people's faces as we helped them with that. I had a sore arm the first time, mildly. It wasn't a big deal at all. It was really no different than my flu shot a couple months ago. And I had a sore arm the second time. I mean, to be honest, a couple of us around, my chief scientific officer and I, others, we're honestly joking around a little bit. We'd have rather had more side effects because we know the vaccine's working for sure. But really very mild. It was no big deal. I will say across our vast experience now, we're seeing mild flu-like issues. Second dose is a little tougher than the first dose typically if people have issues, but it's frankly the vast majority say, hey, this has been really no big deal. Dr. Narcisse?
The same. I had a sore arm for a few days. Nothing that's out of the ordinary for getting my regular influenza vaccine or tetanus vaccine or any of the other things.
Thanks very much. I appreciate it. Dr. Boom, I have a question for you. Not everyone has a primary care physician that they see regularly. So people are curious to know, how are vaccines being distributed if you don't have a primary care physician? What are the steps that one should go through to make sure they're vaccinated? Sure,
that's a great question, and we've worked very hard to have a whole bunch of approaches to make sure that we can reach as much of the population as possible. So what we did after focusing on 1A individuals, and keep in mind, we still, based on prioritization, are told by the state, rightly so, if you have a 1A individual, you need to put them up in the front of the line. And so as we identify more people in the 1A category, they continue to be vaccinated. But we quickly moved to patients, and our medical and scientific committee really took a close look at how best to do that and decided, at least for the first step, we're going to focus on 75 and up individuals. The reason for that is because that's the highest risk group of death on aggregate. And as we looked across our databases alone, we had about 120,000 individuals identified through that. Roughly, there's probably 250,000 plus or so in the greater Houston area who are in the 75 plus age group. So we reached out and began identifying, because we could identify those people quickly, very early on, people in our own database. Subsequently opened up a website where people can essentially register to request to be vaccinated. Don't have to have any relationship with Houston Methodist, can be anywhere in the community. We have opened that up on a couple occasions. Each time we do, very quickly we'll get 20,000 people sign up in a very short period of time. And remember, we get about, now, it was less before, but right now we're getting about 12,700 Pfizer doses. We can get a few extra out of the vials, but it's no more than about 15,000 people a week. So we'll get signups that are well more than that each week we do. So we opened up those links again at the beginning of this week, had another 20,000 people sign up. We're getting a little more vaccine just as a 1 week phenomenon next week, particularly in the Woodlands and in Sugar Land, so Fort Bend County and Montgomery County allocations, and are opening the site up again to get more people signed up there. So continue to follow our site, continue to work through the DSHS site. That's the statewide site that lists all of the hubs around all of Texas, and then you can find links to each of those hubs so you can follow each of those opportunities to be vaccinated as well. There are 13 different hubs in the greater Houston area now. It started with 3 the first week, then 12, then this week now there are 13. There may be more next week, I don't know yet. And so there are a lot of places to get vaccinated, but again, still far less vaccine supply than we'd like there to be.
Thank you. That's very helpful. Dr. Narcisse, I know you touched on this a little bit before, but I think it's definitely worth touching on one more time. So I'd like to ask you, if you've had COVID, should you get the vaccine? This is a two-part question. And the second part of the question is, if you suffer from allergies to medications or have any other issues, should you get vaccinated?
So the answer is in development, but I think it's very, very clear to date that some individuals will have mild COVID infections, others will have more severe COVID infections. And it may be that depending on how much of a COVID infection you've had, you may have a different immune response. And so that seems to be different from person to person, and as a result, not quite as reliable. The vaccines that are currently available have been very, very well studied, well vetted. I think we feel very, very comfortable in understanding what is the magnitude of the immune response in individuals. And as a result, we are recommending that individuals who have had a COVID infection still get the COVID vaccine. Even if you've had the infection, you should still get the vaccine, unless you're one of the groups that has a contraindication, as we discussed before.
And in fact, and just to kick in there, talking to our head of infectious disease, you literally just wait till the day you're asymptomatic and you're already eligible to get vaccinated after you've had a COVID infection. The only thing that would throw a wrench in the works is if you had been hospitalized and received convalescent plasma or a monoclonal antibody therapy or something like that. You'd know if you'd gotten that. Otherwise, by all means, you should get vaccinated.
Perfect, thank you. Dr. Boom, I'd like to go back to how you mentioned during your presentation that it's necessary for us to still wear a mask even after we're vaccinated, but the why behind it. Why do we need to? Because someone asked in the chat, if we don't wear a mask during flu season and we're vaccinated for the flu, then why do we need to wear a mask after we're vaccinated for COVID-19?
No, that's a great question. Well, let me tackle the flu one first. We may see that change. I will tell you, this year we have had, almost zero flu infections in the United States. It's been absurdly low. We saw the same thing in the Southern Hemisphere last summer. So in other words, physical distancing, wearing a mask, we can pretty much extinguish the flu plus vaccinations by doing that. So we may see some behavioral changes happen in the future. So masks work. We know they work. Let's think through a population. Right now, the population of Texas, about 1 in 6 people has received vaccine. Now, some of those received it yesterday, so they're not even immune. But let's even assume that all of them are immune already. And we know maybe 20% of people have had the infection, and they'll have some immunity. It may, as Dr. Narcisse talked about, not be durable immunity. The only way we know for sure they're going to get durable immunity is through the vaccines and maybe some boosters in the future that we do. So you're still talking about 2/3 of the population at least, who have never seen this virus before. And so we have to protect each other, and we have to prevent the virus from moving around the population. At some point, if we can achieve herd immunity and really bring this out of out of the system, we can return to not wearing a mask. But until then, those are still the best strategy we have to prevent this from going around. So people ask, well, I got vaccinated, why should I wear a mask? Well, first and foremost, 2 things. One is several things. Let me start with, even the current vaccines that are 95% effective, that's 95% effective, they're 5% not effective. So you still have risk of getting ill with the virus. We still don't know, do they have what's called sterilizing immunity, which is to say you can't even get the virus. We don't know that. What we know is that you don't get sick from the virus. So the studies said we have 95% fewer people with illness from the virus. We don't 100% know yet, does it completely prevent you from getting the virus? We think it does, but we don't know that for sure. So we don't know if you could still carry it to someone else unwittingly and make somebody sick and not wanting to do that. The other thing's a very practical matter, right? If I walk into a supermarket and now the people who got vaccinated aren't wearing a mask, and now there's, a third of the people aren't wearing a mask. Frankly, I don't know. Are you the safest person next to me because you've been vaccinated, or are you the least safe person next to me because you are somebody who's flaunting the recommendations to be masked and probably flaunting a lot of recommendations as well? So from a pure practical basis, it's just not possible. So everybody should understand and expect it will be months and months and months of wearing a mask still while we get the population vaccinated and really change the course of this disease.
So just to clarify, if you've received the vaccine and you can still get COVID, if you get COVID, will you probably have a milder case? That was a question that came up.
No, it's a great question. So if you look at the studies, including now the newer studies, again, with the caveat that Dr. Narcisse said, we've just seen a press release. We haven't seen the actual data. So I'm going to focus on Moderna and Pfizer, is that they appear to not just prevent severe disease, but they for the people who then got, or not prevent, I mean the infection and the disease, for the people who did get it, saw very few. In the Pfizer, I think it was 1 out of 9 or 10 people that they saw in the Pfizer trial out of the tens of thousands who were vaccinated that actually had severe disease, and in the Moderna trial they had none actually in that group. So we do believe even if you still get it, it would significantly decrease the riskiness. And this initial press release data on Johnson & Johnson looks like, although it may only be in the mid-70s effective at preventing disease at all, the rest of the people who did get it look to have very mild disease. And so that's very similar to the flu shot. We know the flu shot every year doesn't prevent every case of flu, but if you get it, you probably have, and you do get the flu, you probably have a milder case of the flu.
Thank you. Dr. Narcisse, I'm going to change the angle a little bit with a question. We actually received the same question several times. There's several women that are thinking about getting pregnant or currently are pregnant and trying to make the decision as to whether or not they should get the vaccine. What advice would you give to them based on the science information that we have to date?
The study specifically did not address individuals who are pregnant. So the data that we have doesn't really answer the question very, very clearly. But what we do know is that individuals who are pregnant who get COVID can have significant illness. And while everyone is worried, what will happen 5 years, 10 years, 20 years from now, I think at this point it's safe to say that the vaccine works, the vaccine is safe, and so for pregnant women, just as most other individuals in the population, they should still get the vaccine.
Perfect. I have a follow-up for a different group of folks. Myself having children and many people that have kids that they want to have back in school again. We received a question that said, what is the timeline right now for the CDC to approve a vaccine for older children, ages 12 to 16, as well as younger children, so they can go back out to the park and have fun again? Do we have any information on that?
2 days ago, my wife got an email to consider enrolling our 12-year-old in the Moderna trial. There's actually a site here in the Houston metropolitan area that's actually requesting individuals to come in. And so that is being studied. It's still going to take time. They are still enrolling individuals, so it will take several months before we have the answer to that question. It does look like it's safe in general. It's believed to be safe in children, but we need to get the data before we can answer any questions.
That's helpful. Thanks very much. Dr. Boom, we have a viewer that's wondering, do you feel comfortable dining indoors now that you've been immunized from the vaccine?
Great question. I have not eaten in a restaurant since the beginning of the pandemic. Would I feel far more comfortable now that I am vaccinated? Yes, no question. However, I still believe we need to get the level of virus way down in the community before we start really changing behaviors. And so, in my role, I really try to lead by example. So I still have not done that. As we see the virus levels come down, we see the vaccination levels come up, I will change that behavior for sure. But I think a key message, again, is the vaccine's not this golden ticket that suddenly you go do everything like it was. I think out of respect for everyone else, out of the fact that we are a community, I think it is one step along the way to get, to getting back to normal. And so to date, no, but I will at some point in the future.
Thank you. Dr. Narcisse, trust has been an issue that's come up in the community with the speed that the vaccine has come out, as well as many communities of color. So I'd like to ask a couple questions, if you don't mind, around that subject. The first question that we received is, I've read it normally takes 10 to 15 years to develop a vaccine. How can we trust a vaccine that was developed in less than a year? And I'll ask a follow-up after that.
Sure. Well, this was a remarkable effort. I think that this is one of those things that we'll look back as my father talked about going to the moon, that the development of these vaccines is a tremendous advancement for all of humankind. But they were developed very, very quickly. Should this be a concern? The answer is no. The technology that is in these vaccines were developed initially in response to other vaccine outbreaks. You might remember approximately a decade ago, SARS and MERS, and those are close cousins of the coronavirus that is causing COVID-19. And so people were working on the technology as far back as that would work here. And so it's like you've already built the car. You've already gassed the car up. So these things were in place in advance, pre-stage if you would have it. And then once we understood the genetics of the coronavirus, initially out of China, scientists were able to take that genetic information and plug it into the car just like you would download a GPS map into the car. So the last thing that was necessary was the GPS map, and then we're off on our way. So yes, this was faster than other vaccines. This was tremendous, but it wasn't motivated by individuals with untoward concerns. I think that it's safe. The science has been well vetted. The first slide I showed you was from our medical journals. Many of the scientists around the world have had transparent access to all of the information. So I think that there's reason from the science to develop trust in the process.
Perfect.
And I'd like to add on just a little, which is, this rapidity and this ability is going to be tremendously good news going forward, because as we're looking at these new variants that are emerging, it looks like the UK variant, which spreads more easily, probably is covered as well by these two vaccines. But emerging data really suggests that the South African variant that we're seeing right now, that may not be the case. We saw these two new vaccines that are coming out where they're seeing different results in South Africa, so that may imply that that's the case. With the Pfizer Moderna, as they've been studying it, there's at least one study that suggests the neutralizing antibodies are not quite at the same level, although that doesn't necessarily say they won't be as effective. We just don't know yet. But the bottom line is their ability to rapidly say, okay, now the virus is mutated, we need to tweak the mRNA piece that goes into the vaccine and now create booster shots and adjustments over time is going to be very rapid. So it's quite possible we're going to see a situation very much like the flu, where every year we're getting an adapted vaccine because we're seeing new strains emerge. And I think this technology may allow us to do that very effectively and very rapidly. And very importantly, as Dr. Narcisse said, while the end piece was quick this year, there's been years and years, if not decades, of research kind of building to that point. And remember, a lot of the speed this year was because a lot of things were parallel process that normally would have happened in sequence. So they spent a ton of money they wouldn't have normally wanted to spend, because you don't do that till you know one step works and move to the next. That was Operation Warp Speed. And so that wasn't really cutting corners as much as just throwing money at a problem right now to move quickly during what you need to do during a pandemic. I have gotten the vaccines. I would happily give this to everybody I know and love, to make sure that they're protected, and feel very confident in the data that we've seen.
Thanks very much. We have a couple of minutes left, so I'd like to ask you all just a few more questions, if you wouldn't mind. I think it's no secret who's been impacted the most, which are our communities of color. And so historically speaking, our Black and brown communities have concerns due to the historical treatment of people of color. And so I'm curious to know, Dr. Narcisse, I'll start with you. What would you say to our communities about getting the vaccine? What's the one message you think is important? And Dr. Boom, I'll spread that to you next, for us to talk a little bit about kind of what is seen to some as the elephant in the room, but something that really does need to be addressed. We don't have a long time to delve into it, but I'm just curious to know your thoughts on both sides.
Well, it's very clear that communities of color are disproportionately affected. African American community, 1.4 times more likely to get ill. More than 2.8 times more likely to die of coronavirus complications. So these communities are at particular risk, but there is a sense of decreased trust. This trust is a long-standing problem, and it goes back as far as one could. In my own family, my grandmother tells a story before she died of being a young woman who had appendicitis and went to a hospital that said no, she could not get her operation there because of the color of her skin. She actually followed a boy to Tuskegee, Alabama in the Army, and got married. That's where my mother was born. And she personally knew patients who were in the Tuskegee syphilis experiment. So the story of individuals who were denied access to the treatments that were available and later widely accepted is well part of the story. And to more modern times, there is a sense of disproportionate different outcomes in healthcare in Black and brown communities. Some of that is genetics, but much of it is the lack of resources, from transportation to nutrition to access to healthcare. And so it's great that the Methodist community has done so much outreach into these communities. So it's very, very clear. If you're a person of color, then you're at increased risk of getting sick, you're at increased risk of dying, and you're in the group that would potentially benefit from the vaccine. So in my family, I'm telling all my family members that they should get vaccinated. My family is in the process of doing that.
Thank you. And Dr. Boom, do you have anything to follow for that?
COVID has been, in one way, one of the great equalizers, right? Any human being anywhere on the planet can get this terrible illness. And then it has also, at the same time, exposed such vulnerabilities and such inequities that happen in healthcare, what we oftentimes in healthcare refer to as social determinants of health. Poverty levels, the color of your skin, the neighborhood you live in, the access to healthcare that Dr. Narcisse talks about. And those are great tragedies, quite honestly. And to me, one of the great tragedies of COVID has been on the front end and throughout, the disproportionate impact on people of color. And I really worry about the same disproportionate impact and really the back end tragedy of potentially people of color because of hesitancy or because of problems with distribution into communities, suffering at disproportionate levels on the back end. So that's what we together have to work to fight. And so we've been very purposeful, very intentional as we look at these sign-up processes, as we work on how to get the vaccine distributed, as we work with many of our partners in the community like federally qualified health centers, as we work with specific churches and communities. We're really working hard to make sure that we can distribute and get vaccine into every single community everywhere at equitable, equal levels so we can bring down this pandemic together and not have any of those inequities exposed. To be honest, it's hard work. The issues Dr. Narcisse talked about hesitancy and about distrust are very real and understandable. I mean, the tragedies of things like the Tuskegee, the abhorrent nature of things like that are a history that we can't change in healthcare, unfortunately, and we're all living with the consequences of that today. And so anything we can do to work with people in every community to encourage vaccination, I think, benefits everybody. And so we will continue to make sure that we're driving towards that together as a community and as an institution.
Thanks very much. And these are conversations that we will continue to have as we move forward, not just with COVID, but healthcare in general. We have time for one more question that I'd like to pose to Dr. Boom. Dr. Boom, I've received more probably than a dozen questions for the town hall today from people that have pre-existing health conditions. And so they're wondering whether or not to get the vaccine. So as we close today, what advice would you give to people that have pre-existing health conditions that are curious to know what should I do when it comes time for me to get vaccinated?
Sure. And I think a lot of those questions have to do with, hey, I'm on this set of medications or I have this specific issue, and how that might impact somebody's both desirability of getting a vaccine, safety of getting a vaccine, should they get a vaccine. Almost always the answer is going to be even more so you should get the vaccine if you have certain predisposing factors, risk factors, meds you're on. But, it is something I would encourage everybody to talk about with their physicians. Obviously, if they're on drugs like that, they've got a clinical relationship somewhere, somebody who's prescribing those drugs. Discuss that with those individuals. But again, the vast majority of time, the answer is going to be absolutely. In fact, you should be, towards the front of the line, not the back of the line from getting vaccinated if you do have many of those detailed health issues, whether drugs or conditions that you have.
Thanks very much, and I think Dr. Boom will turn it over to you for the close this morning.
Well, thank you, Ariane. Thank you, Dr. Narcisse. I appreciate both of you being with us today and bringing your expertise to bear and having a great dialogue here. I want to thank all of you for joining us. Really, information, apolitical, fact-based medical and scientific information really is the answer to how we get out of this pandemic. And these vaccines, as Dr. Narcisse said, are a triumph of medical science and something we should be celebrating. And I agree with you. We're going to be celebrating them just like we celebrated putting somebody on the moon, 50 years ago, 60 years ago, whatever that was now. I'm messing up my math, 50. But we will celebrate that, I think, for decades to come. And I have no doubt the technologies we're seeing are probably going to be platform technologies for many future advances, whether vaccines or perhaps cancer therapies or other things in the future. So we're all in this together. It's been the case every moment of this pandemic. As I said, this affects everybody in humanity everywhere around the world. So the only way to get out of something like that is to work together, to protect each other, to look each other in the eye and say, I'll protect you, you protect me. And that's what vaccines are. They're the ultimate symbol, I think, of love and respect for the rest of humanity, because while you protect yourself, at the very same time you protect many others, including sometimes some people who can't take a vaccine because of health issues they may have or some of the allergic history they may have, etc. And so I urge everybody to do that. I urge everybody to continue to follow all the advice about bringing this curve down through wearing a mask, through avoiding unnecessary social situations, through physical distancing, and all the things that we know work. The hope is there, the light at the end of the tunnel is there, but we've got a long way to go, and we're frankly in a little bit of a race with some of these mutations where we want to make sure we bring the viral load down, because every time you've got more people with virus, it's another chance to have more mutations. So the more we can bring these curves down, the fewer mutations we'll see, the quicker we'll start emerging into something that will be a new normal, and one heck of a lot better than this last year that we've all experienced. So thank you all for being here. God bless each of you, and stay safe.